Hello, good day. I'm Princess Joy Bolivar, and today I will be presenting a case study about asthma. So, based in this picture, we can say that asthma is a chronic inflammatory disorder of the airway characterized by airway hyperresponsiveness, mucus hypersecretion, and reversible airflow limitation. Chronic inflammation associated with asthma thickens the airway walls or changes their structure. Did you know that in Australia, around 2.7 million Australians, or 11% of the total population, have asthma, based on self reported data from the 2017-2018 Australian Bureau of Statistics and National Health Survey? Australia has the second highest prevalence of asthma in the world. Asthma is the most predominant obstructive pulmonary disease in Australia. The prevalence of asthma among indigenous Australians was 1.6 times higher than non-indigenous Australians after adjusting for difference in age structure. So the aim of this presentation is first to discuss underlying pathophysiology of one of the clinical manifestation of asthma and to describe one high priority nursing intervention in order to improve patients' clinical manifestation. So the case study is Jackson Smith, 18-year-old male, was admitted to emergency department at 9 p.m. with severe breathlessness. His family informed that he has history of asthma that had been diagnosed when he was 2 years old. On admission to the emergency department, the clinical manifestations were first, severe dyspnea, inability to speak sentences in one breath, respiratory rate of 32 breaths per minute, oxygen saturation of 92% on room air, pulse rate of 130 beats per minute. Auscultation of lungs identifies diminished breath sounds and widespread wheeze. Chest x-ray shows clear and hyperinflated lung fields. A provisional diagnosis of acute severe asthma is made. Now I will be discussing the pathophysiology of severe dyspnea as my clinical manifestation of asthma. First, it will start from the airways responding in an abnormal way to inflammatory mediators such as an allergens triggered by pollution, exercise, cold air, or respiratory infection. Sensitive responses can be introduced by a type 1 hypersensitivity reaction. Second, due to exposure to irritants, thus will result in a course of events starting with mast cell degranulation and the discharge of several inflammatory mediators called histamine, interleukins, prostaglandins, leukotrienes, and nitric oxide, which are the vasoactive effects are vasodilation and increased capillary permeability, thus causes an increase in blood flow to the area and inflammatory cells, and chemicals move through the cells into the interstitial tissue. Number 5, initiation results in a local release of pro-inflammatory cytokines and tissue swelling in which both cases chemotactic factors are manufactured, which further result in bronchial infiltration by eosinophils, neutrophils, and lymphocytes, that these activated immune cells, especially eosinophils, release multiple of chemicals that contribute to swelling and tissue impairment. 6. Resulting to inflammatory process produces bronchial smooth muscle spasm, vascular congestion, edema formation, production of thick mucus, impaired mucociliary function, thickening of the airway walls, and increased bronchial hyperresponsiveness. 7. Which further result to air trapping, alveolar hyperinflation, and even perfusion causing impaired gas exchange in the lungs, results to clinical manifestation of dyspnea, which is increased airway resistance, leads to increased work breathing. So my nursing intervention for severe dyspnea is to encourage Jackson to use pursed lip breathing while the head of the bed is elevated. Pursed lips breathing is a breathing technique used to address breathlessness and those who have trouble breathing, typically associated with chronic lung disease. As one of the easiest methods to control breathing, this technique is most effective when breathing is labored or under stress. Pursed lip breathing helps control shortness of breath and provides a quick and easy way to slow your pace of breathing, making each breath more effective. When feeling short of breath, pursed lip breathing helps get more oxygen into your lungs and calms you down so you can better control your breath. To practice pursed lip breathing, sit down in a chair or bed and relax the neck and shoulder muscles. Breathe in slowly through the nose, making sure to keep mouth closed. Inhale one, two, then purse the lips as if you're going to whistle or gently blow out a candle. Then breathe out or exhale all of the air in the lungs through the mouth, slowly and gently through pursed lips. Try to breathe out longer than inhaling. Continue to repeat this exercise of slowly inhaling through the nose and exhaling through pursed lips until breathing becomes normal. Pursed lip breathing works by moving oxygen into the lungs and carbon dioxide out of the lungs. This technique helps to keep airways open longer so that you can remove the air that is trapped in your lungs by slowing down the breathing rate and relieving shortness of breath. The pursed lips breathing method offers significant mental and physical benefits. For example, it can help in the following ways: releases trapped air in the lungs, keep the airways open longer and eases breathing, prolongs exhalation to slow the breathing rate, improves breathing patterns by moving old air out of the lungs and allowing new air to enter, relieves shortness of breath, and promotes relaxation. To recap, dyspnea in asthma is caused by air trapping with alveolar hyperinflation, bronchial smooth muscle spasm, vascular congestion, thickening of airway walls, and increased bronchial hyperresponsiveness, and can be relieved by the help of pursed lip breathing while the head of bed is elevated. Thank you for listening and watching. I hope you enjoy.